So apparently President Trump's coronavirus response is all the rage now. Get it? Rage. All right, hello everyone. Just want to remind everyone, don't forget to like, share, and subscribe to the channel. Liking and subscribing goes a long way with helping getting a new channel like this, the message out there, the information out there, and YouTube picking up the algorithms. So again, just want to encourage you, if you are new to the channel, and you like the information, please subscribe. And to everyone, whether you're new or not, and if you already are subscribed, don't forget to hit the like button. So let's get into this now. So apparently a new book has been released with some audio that the press is just jumping all over as the next gotcha moment for President Donald Trump. It was a book recently released by Bob Woodward, titled Rage. And a lot of what I'm hearing is, and this is just to put it mildly from a lot of the coverage, is, Trump met the coronavirus, which was the great crisis of our age, with ineptness, dishonesty, and an epic dereliction of duty, is what we're hearing. Things like, and if I had to sum it up a little bit more nicely, they're saying that he completely lied to the American public. We were underprepared. He knew things that he didn't share with the public and lied to us about the seriousness of it. But is that really what happened? So before I go any further, really, I'm going to go play the audio of the controversial audio regarding some of what President Trump knew before the back in February during this interview with Bob Woodward. So let's roll the audio.
And so what was President Xi saying yesterday?
Well, we were talking mostly about the virus, and I think he's going to have it in good shape, but, it's a very tricky situation.
Indeed.
It goes through air, Bob. That's always tougher than the touch. The touch, you don't have to touch things, right? But the air, you just breathe the air, and that's how it's passed. And so that's a very tricky one. That's a very delicate one. It's also more deadly than your strenuous flus. People don't realize we lose 25,000, 30,000 people a year here. Who would ever think that, right?
I know.
It's pretty amazing. And then I say, well, is that the same thing? This is more deadly. This is 5 per, this is 5% versus 1% and less than 1%. So this is deadly stuff.
All right, so let's unpackage that audio a little bit, try to break down what we do know so far from that audio and what was going on at the time. So that audio recording was done, I believe, around February the 7th, 2020. And so let's just unpackage one part of it. So the first part where he's talking about this being airborne. Well, what did we know at the time? What was going on? What was being said? So as far as the virus being airborne, there was a lot of evolving information coming out about the transmission of the virus. The World Health Organization, for instance, so just 3 weeks prior to that audio recording, this is what the World Health Organization was putting out there to the world, famously on January the 14th, 2020. So you saw it for yourself. I'll put a look of it right there in the corner of this video right here as well, of the tweet, where the World Health Organization is outward saying, don't fear of this virus. It's, transmission between person to person isn't that high according to all the evidence that we have. That was in January that they were saying this, that the World Health Organization was saying in January that transmission from person to person was very low, nothing to be afraid of. All right. And then, as far as whether or not this is airborne, so you heard in the audio Trump say something along the lines of this travels by air. Well, there was a lot of conflicting information back then in February regarding just how this virus is, exactly how is it transmitted. Is it through aerosol or droplets? Now, both come through the mouth by air, potentially, but droplets due to the size and heaviness of the droplet, and gravity. It can only go out from your mouth if you cough, sneeze, whatever, no more than 2 meters before it drops straight to the ground. Whereas aerosols, because they're much lighter, can linger in the air just a little bit longer, go a little bit farther, but it doesn't mean that they stay in the air indefinitely. But was it aerosol and or droplets? Was that even confirmed at the time? Here's from the CDC themselves, maybe 2 days after this audio recording with Bob Woodward, regarding whether or not we knew if it was aerosol or not. This was done on February the 9th, 2020. So let me roll the clip.
And roads. The expert also said that the aerosol transmission is yet to be confirmed.
目前新冠状病毒最主要的传播途径是近距离的呼吸道飞沫。
Droplet transmission is still the main channel for infection. Aerosol can cause transmission at a greater distance, but it can only happen in certain clinical circumstances. There's no evidence showing aerosol transmission in normal situations. We suggest the ventilation of rooms at least twice a day and wearing a face mask at work. That will be enough to protect yourself from infection.
So there you have it. The CDC, 2 days after this Bob Woodward interview, could not, they actually downplayed from a scientific standpoint whether or not if this was aerosol or droplets. So both by air, to some level, coughing, boom, boom, but droplets, big difference from aerosol. There was no conclusive evidence at the time that Trump recorded that video, which was, again, actually even after, based upon what they were telling us at the time from the CDC, whether or not if this traveled by aerosol or droplets, both obviously coming from your mouth, air. Are we even going to argue that the president was even knowledgeable to the detail, the science behind it, or was he just putting in layman's terms? Oh, by air. Again, if I cough, that's technically air, but if it just goes straight down, it's not the same as aerosol. So there was a lot of conflicting scientific information regarding this. Some were saying it's possible by aerosol. As you saw from the CDC video, it said it was not conclusively proven that it traveled by aerosol under any kind of normal situation or under any normal circumstances. That was the CDC. So was it by air? Technically, yes, Trump was correct. I don't think he was ever saying this can only be transmitted by person to person. I'll have to find the video. But there was some evidence that at least coughing, hence why they encourage if you were sick to wear a mask, things like that. But there was conflicting information. Would that have made the world of difference? Can you really even say we had information that nobody else in the whole entire world had? Was our response really that much worse than the United Kingdom, to Canada, Spain, Italy? When you look at the numbers, no. The only thing that puts us over many countries are the piss poor numbers that have occurred in New Jersey and New York. And those were the results of the failures of their leadership, and specifically the nursing home mandate is what really accounts for the majority of those two states' numbers. But other than that, there is a lot that's out of control. But again, was it airborne? What's the definition of airborne? It was definitely up in the air at that time. Nothing really settled scientifically back in February. It could have been aerosol, could have been droplets. Droplets would have been more easily contained. All right, the other part of the video talked about the deadliness of the virus. So he's saying to Bob Woodward how this is deadly, more deadlier than the flu. He specifically said 5%. Like this was 10 times, he was reiterating something that Fauci said regarding this being 10 times more deadly than the flu, upwards to 5%, as opposed to under 1%, which is the flu, which is the influenza. But is that even true? And the answer to that is no. That was false. Even when Fauci said this.
Probably for the practical understanding of the American people, the seasonal flu that we deal with every year has a mortality of 0.1%. The stated mortality overall of this, when you look at all the data, including China, is about 3%. It first started off as 2 and now 3. I think if you count all the cases of minimally symptomatic or asymptomatic infection, that probably brings the mortality rate down to somewhere around 1%, which means it is 10 times more lethal than the seasonal flu. I think that's...
As we know it as a fact today, the coronavirus, COVID-19, is not 10 times deadlier than the flu. The death rate is not over 5%, not even close to, oh my God, 5% is such an off number. It's not even, it's not even funny. 3% that was going around as late as March was far off. It is less than 1%. Probably the death rate for the coronavirus is more likely around 0.03%, 0.3%. So not even a whole 1%. So the president was off. Those numbers were fear-mongered, totally inflated, way too high. Those numbers were based upon only people who were gravely sick. It did not account for, obviously, people which represents a grave majority of the world population, those who were asymptomatic. So a lot of the numbers what numbers we did have. Let's not forget, China was hiding a lot of information. They still are, giving a lot of fake information, or misinformation, I should say. So those numbers were way off, only really accounting for the people who were gravely sick, going to the hospital. So the numbers looked a lot higher than what they really were. So was he downplaying? If he were to come out and say death rate of the COVID was 5%, he would have been spreading so much fear and panic and misinformation at the end of the day, because again, the death rate for this virus is not 5%, it's not 3%, it's not 1%, it's under 1%, more along the ballpark of 0.3% to 0.8%, which is a bad flu season, point blank. So that was wrong. It would have been wrong and reckless for him to have shared that and said that, because he just would have been spreading fear as well. President was trying to, yes, make the country feel safer, feel better, not panic. That's what a leader should do. If there's a building on fire, you don't panic and say, everyone run, run, move out of the way. You don't pull like a George Costanza.
Everybody, I think I smell some smoke back here. There was an inferno in there.
You want to remain calm, try to keep everyone at ease. Think of the Titanic as it was sinking. At least, the theatrical version movie. I can't say that's how it actually happened, but in the movie, you still had the orchestra band playing their music to try to mellow everyone. Everyone trying to keep people calm, get them on the boat safely. That's what you want to do. President was just trying to reassure the population, to the country, we're working on getting this under control. You should be fine. And is that any different than what any other world leaders, any other leaders in this country were doing? The president, Congress was in a lot of these same briefings. They were getting informed no different than the president, Nancy Pelosi, Chuck Schumer. And what was their response during the midst of it was this.
Come out again and not be afraid.
Also to say to everyone, you should come to Chinatown. Precautions have been taken by our city. We know that there's a concern about tourism traveling all throughout the world, but we think it's very safe to be in Chinatown and hope that others will come.
This in some kind of context for this big city.
Willie, 8.6 million people here. We have 25 cases as of this morning, and we care deeply about each of those individuals, but against the backdrop of 8.6 million people, and for the vast majority of New Yorkers, life is going on pretty normally right now, and we want to encourage that. Look, we've got to look out for people here, especially those who are over 50 years old and have pre-existing conditions like lung disease, heart disease, cancer, diabetes. These are the folks we really, really need to be careful for. But if you're under 50 and you're healthy, which is most New Yorkers, there's very little threat here. This disease, even if you were to get it, basically acts like a common cold or flu. And transmission is not that easy. I think there's been a misperception that coronavirus hangs in the air waiting to catch you. No, it takes direct person-to-person contact, direct transmission of fluids. So what we're finding is we're giving New Yorkers a lot of guidance about how to be careful, wash your hands more, use hand sanitizer, cover your mouth when you cough and sneeze. Here's an easy one, Willie. If you're an older person, and especially if you have those pre-existing conditions, don't visit folks who are sick. You want to see your grandchildren, they have the sniffles, that's not the time to see them. So what I'm finding is New Yorkers are pretty tough, and they're listening, and they're making adjustments. Schools are running, and we've said, even if, God forbid, we found a case in a school, we're not shutting down all our schools. We're not even shutting down that school long term. We're going to go in, clean that school, isolate individuals who had that really direct contact, and then get up and running. We'll have a day where a school is shut to get reset, then get back up and running, because people's livelihoods are at stake. Parents need a place for their kids. We can stay safe, but still keep our lives going, our economy going. People have to pay the rent. People need money for food, etc. We cannot shut down because of undue fear. That's my concern. So
there you have Nancy Pelosi, Bill de Blasio, encouraging people, hey, nothing to fear. Life goes on as normal. We're going to act responsibly, inform the public, inform the population of things they need to do, what not to do. But we're not going to shut down. We're not going to panic. And that's what a leader does. They want to be optimistic and at the same time realistic regarding. But here you had them, at least particularly Nancy Pelosi. Bill de Blasio, mayor, may not be in the same briefings, but Nancy Pelosi, of all people, was informed in getting the same CDC briefings as the president, was in on everything, was not out of the loop, and yet she was still saying, let's get out to Chinatown, nothing to fear. This is, a great time. Let's not panic. And let's not forget that everyone was pushing back when the president was taking measures to try to secure the country. He first issued the travel ban to China on January 31st, 2020. And what happens? Everyone criticizes him. This is problematic. This could hurt our response to COVID-19 around the world. This could be perceived as xenophobic. And then you even have Biden tweeting this. So even when President Trump tried to mitigate the access to the virus to this country by banning China and then later banning the rest of the world and issuing a travel ban, it was met with criticism from everyone. So it's like damned if you do, damned if you didn't. And my question is, if you have all of these, particularly Democratic politicians saying or criticizing him at the time that he was doing a travel ban, whether it was specifically to China and or the rest of the world, what would have their different response have been? Because based upon their pushback on his travel ban, it's likely that they wouldn't have banned travel any sooner. It would have been later, right? I mean, I'm just asking the question. He bans travel to China January 31st. He gets pushback from everyone around the world, including here in the United States. So he did it then. They said no. The only logical conclusion would have been y'all would have waited to ban travel a lot later. So how could you say that you would have been any different when you criticized him at the time? I honestly believe that there have been failures across the world as it pertains to this coronavirus, but I don't think it's because of the virus itself. I do believe that there are powers in this world that are using this virus in order to have the biggest power grab and wealth transfer in human history done right under our nose. They're using this to strip away our freedoms while gaining more power for themselves and gaining more wealth, because it's a fact that the richest 1% of individuals in this world, the billionaires, saw at least a 14% increase in their wealth over the course of this lockdown across all over the world. Billionaires, whether it be in the United Kingdom, here in the United States, just saw massive wealth gains, whether they were dumping stock, they're buying up property at dirt cheap, while the middle class and working class got even smaller because they lost their job, lost their ability to pay their bills, lost a lot of their properties, couldn't keep up with rent and or mortgages are falling behind. So there was a big transfer, and then this became a great chance to control information, control content, control what you hear, what you see, and what you don't see, what's considered misinformation and harmful information. And you're having this done on the media, social media, whether it be Twitter, Facebook, YouTube, telling you, all right, listen to the expert, but not these experts, not those experts, listen to the ones that are in line with what we're saying. And keep in mind, platforms like this here on YouTube, Facebook, Twitter, if it doesn't go in line with the World Health Organization, they consider it misinformation, even if it's coming from another qualified medical or scientific community and or individual. And yet, look how wrong the World Health Organization has been from the beginning, whether it was how this virus is transmitted, whether it's human to person-to-person contact, aerosol versus droplets. They have been the travel ban, saying that was not the right way to go about it. They have been wrong, but if you go against their narrative, you're banned as being part of misinformation. So that's all. I don't think that this is just the great gotcha. What President Trump said about the deadliness of this virus has been proven to be completely off. If you are under 50, healthy, like de Blasio said in that interview, and it's probably going to bite them in the butt, in the future, based upon the narrative that they've been trying to push so far. But he was right. If you're under 60, or better yet, under 50, healthy, no pre-existing conditions, no respiratory issues, not diabetic, no asthma, no COPD, you're not morbidly obese. If you're someone like me, healthy, in shape for the most part, eat right, you're gonna get this no problem. You have like a 0.01% chance of dying of this. All right, and that's just the fact. It's not that deadly. And fact of the matter is as well, unlike the flu, this does not seem to be affecting children the way the flu does. The flu does spread among children rapidly, and it affects them. You are not going to have a 40% chance of catching the flu and being asymptomatic. That's just not going to ever happen, ever. But children are not falling victim to this virus in any great number, unless if they met the qualifications I mentioned earlier, criteria about severe pre-existing conditions. Finding a child that has succumbed to COVID-19 with anything more than a sore throat is like finding a lottery winner. They happen every single month. Someone wins a scratch off, Powerball, jackpot, Mega Millions. They do happen. You notice on the billboard, the number gets larger and larger, 100 million, whatever, and then all of a sudden it's back down to 20 or 40 million. Oh, someone won the lottery. It happens, but that's how rare it is with COVID and children. That's been proven. Never the case with flu. This is disproportionately affecting the elderly than any other group, and children. It's, again, been proven. Someone proved me wrong. Give me the link or study to show that children are. It's not about getting infected. You can get infected. It's a matter of who's getting gravely ill, who's suffering very moderate and or severe symptoms to COVID and or who's dying. Kids do not make up any large portion of hospitalizations whatsoever, and or death is statistically zero. So is it more deadlier than the flu? No. Even the CDC recently came out and said, even with their inflated numbers, as inflated as they are, only 6% of the deaths were strictly COVID. The other 94% were caused mostly by, or aggravated by their pre-existing conditions. So only 6% of the people who contracted the coronavirus actually died solely of the coronavirus. And there are going to be people who clap back, well, those 94% still died. If they had those pre-existing conditions, they weren't going to die, at least not right away. So even if they had pre-existing conditions like morbid obesity, COPD, but then they got the coronavirus and then they died, but they otherwise were going to live, coronavirus still killed them? No, it was a myriad of things that was killing them. Coronavirus itself was not necessarily the major thing. All right. And we've had health officials already on record as saying, even if you're already dying, you're in hospice and you're set to die in 2 weeks, you contract the coronavirus, COVID-19, they're going to count that as a COVID death, even if you were already dying. COVID-19 does not kill someone in hospice. They were already dying of a myriad of things, but those were still counted as COVID deaths, so don't come at me with that. The fact is, again, this is not deadlier than the flu vaccine for the majority of the population. We do need, though, to take care of those who are greater risk of this. But again, what Trump said about this being deadlier than the flu turns out to be not the case. All right. Was this traveling by air? Yes, but I believe I've already proven that that was disputed at the time. We didn't have any more information than any other country, including the CDC of China. We had all of the same information, and a lot of it was evolving as it was going. So this is not really the smoking gun when you really put it into perspective. That's my thoughts. Please tell me what your thoughts are in the comment section. So I do want to encourage, even if you disagree, tell me where you disagree. I would love to have that conversation and debate and love to hear your point of view and argue. Otherwise, please don't forget to like, share, and subscribe. And y'all have a great day.